It's more, but that's okay.
Good evening and welcome to our 4 p.m. lecture Zoom class. Today is Thursday, November 16th.
I need
And guess what? We are off next week, Thursday and Friday.
ones.
I will be on vacation the entire week. I will be in Smoky Mountains, Tennessee, in a cabin for Thanksgiving. So I will be checking attendance, but we only have 3 days that we will be on next week. So we will not have Zoom class on that Tuesday. And the last day for you all is Wednesday. So you all are off. You are closed Thursday and Friday. The last day in the module will be on that Monday of next week is the last day for this module. It would have been if we would have had class on one of these days, next week, we would be finished the module. Because we're off for 2 days and it's observation of Thanksgiving, we will not finish that last day. So that last day is going to be on Monday of the day after, the week following Thanksgiving. On that Tuesday, we'll be in a new module. So in this new module, you will have to have a computer. It's no ifs, ands, and buts about it. In order to pass the next module, you will have to have a computer because it's electronic health records. You will definitely have to upload. You'll be doing files, client charts, sending out messages to the patient. You'll be working in groups with sending out information, making appointments, putting in appointments, scheduling appointments, exactly what you will be doing when you finish this course. So it's imperative that you have a computer because that's the only way you'll pass the course, because we'll be in sim chart. Sim charting, you have to have a computer. It's no ifs, ands, and buts about it. So I can't stress that enough. Misty,
Yay, sim chart.
Misty's gonna be gone.
Misty's graduating.
I was gonna say, put me in the group with her.
Yeah,
She's
like Misty,
can
I have your email?
I can give you my phone number, guys.
Yes, she will be gone. So Jared has not been in that section yet. So it's fun. It's fun. It's very interactive, but you have to have a computer because you will be doing patient charting. You will be sending out scheduling for dates. You'll be doing it all, just like you're in a regular office setting.
Okay.
So, it's fun. Like I said, you'll have groups that you can work with and, you can have that person send your name and, however you want to do it, John Doe or Jane Doe or however, but it's very interactive.
Mary Doe.
So it's a lot. Like Misty, remember that EHR system? I mean, it's a lot. You are actually basically can say you're in an office. And a lot of hospitals and clinics still use that system. Some are getting away from it now because they have more to their liking in that clinic, but some still use the sim chart method. So that's what we'll be doing once we come back.
Like when you first get into EHR, it looks difficult, but once you get past getting everything, learning everything, then it's okay.
Yes,
that's the experience I have, y'all. I come from a admissions background in the ER, so I remember back when we were using those sim charts. So yeah, I wondered, could we do that?
The sim chart.
So yeah, so like I said, I have a lot of experience. I started back in like 2001, and then somewhere along the way, my special kind of crazy, I ended up in the ER, and I loved it. So I've worked in the ER.
So it's gonna all come back to you.
The front office part of it, I feel like I could bring something to the table there.
And basically, with her saying that everything's going to repeat itself, it's just going to be repetitive. Every little thing that she has been explaining, it's just going to be repeating over and over and over.
Okay.
So that's what I'm saying. It's very important to, don't just copy the answers out the back of the book. Use that as a reference and read your chapters, read your PowerPoint slides. And then it depends on what specialty you're going to go in. Whereas you're not going to need to know all of those codes, but you're going to have to know how to process, how to find the codes. So just making sure that you're reading the information, learning the terminology, learning those acronyms, because I keep stressing the doctor is not going to write all of that information, spell out all of those words. It's going to be shorthand. Half the time, you're not going to even be able to understand what it is, but you have to know those abbreviations. You have to know those acronyms. You have to know your prefixes and suffixes, and that helps as well with understanding what that word is. So we're going to go ahead and get started. Let me share my screen. Chapter 26 is inpatient coding. Inpatient coding. So I'm going to share right now. So inpatient coding. So before we get started, I know this is the first day that we're going in inpatient coding. So can anybody tell me what is inpatient coding?
They're admitted into the hospital.
Correct. Inpatient coding, they're admitted into the hospital. Outpatient is what? And it basically tells you what it is.
Outside the hospital.
It's
Right.
an outpatient lab or testing done where
Yes.
they walk in and they have their order, or you have to look and search and find the order.
Right. The clinic setting where you're not going to stay overnight. You're not going to be stationed in. So chapter 27, inpatient coding. This is where we're going to use our ICD-10 manual. And I want to start from the beginning with this. Jared, I know you're new. You're not new. You're more seasoned, but you're still new. You haven't been in the inpatient coding manual, right?
No.
Right. Okay. So this is why I want to start from the beginning with it. So in these topics, what we're going to cover, the differences between inpatient and outpatient coding, selection of principal diagnosis, reporting additional diagnosis, present on admission. You see that acronym POA, the abbreviations they use, they're not going to have present on admissions. POA, present on admission. Development of the ICD-10 PCS and chapter review. So in your daily assignment, I post a video for you all to watch. It's a very good video that's going to give you clarity on how as well. And I put it in the lab, and I also posted it in the Zoom class. So make sure that you look at those videos. It's showing you how to look up the main term, what things you should do. That's contempo coding on YouTube. So I posted some videos in there for you all who are having difficulty to understand and how to look up the main term. What is the difference on inpatient coding, like how you look up those words, what it is. So I want you all to make sure that you're looking at that video, and in your daily assignment, I said, please watch video below. Like I said, I posted it in your Zoom class. I posted in your daily assignment, and I posted in the lab. So there's no way you should be missing it. The thing is, it's there, watch it. Because just like on the exam, I've seen some people have started taking the exams, and some of the questions that we've gone over several times that I gave a review, some students have gotten those wrong. It's no way you should get that wrong when we have gone over those over and over again, and I gave you the actual question. So that's showing me that I have students who are not watching the videos, who are not watching Zoom class, who are not logging on and getting the information. Majority of the questions when we review, if I'm explaining to you, saying that it's going to be on your exam, and I'm trying to help you so you'll know what to study and what to look for, it's on your exam. And then you have your resources. You have your textbook, you have your coding manuals, and you have Google. Because we don't have the websites anymore for people to be able to look up. You have to pay for it now, but you have your books. So please use those guides, resources, and look at those videos so you can score higher on your exams. Next, we have here your learning objectives, which is basically the same on your topics. So we're going to go into this now. Differences between inpatient and outpatient coding. It says, our studies until now have focused on physician services and how to report these services. This chapter will review coding for hospital services. For physicians, payment, and this is very important for you all to know, this will be on your exam. So if you want to highlight it or, jot it down or however, this is on your exam, and it's also on your national certification exam. For physicians, payment is based on specific services and supplies reported with CPT and HCPCS codes. So remember that for physicians, payment is based on specific services and supplies reported with CPT and HCPCS codes. The medical necessity of the services and supplies is reported with diagnostic codes. As a result, many coders and physicians call CPT and HCPCS codes the money codes. That's always on a certification exam. What codes are used and what is used for the money codes that they call in the medical world? Many coders and physicians call CPT and HCPCS codes the money codes. Physician services are often referred to as professional services because they are performed by individuals. Physician services can be performed in many places, including hospitals. Because the services provided by hospitals are broader than those provided by physicians, hospitals are reimbursed differently than physicians. Important to know, so hospitals are reimbursed differently than physicians. The hospital is paid for its hospitality, ensuring the patient is housed, fed, and nurtured back to health until the patient is discharged. The length of stay and intensity of services provided to the patient in the hospital vary according to the patient's condition. It's coming up. I don't know what's going on. Coming across the screen. I don't know how that's happening. For example, a young woman admitted to the hospital for a normal, uncomplicated birth usually requires much less nursing care and recovery time than an elderly patient admitted for multiple organ failure and sepsis. The physicians are still paid using CPT, HCPCS codes to report services. Hospitals, however, are paid for their hospitality. Using a formula, a complex formula, MSDRG, based on the severity of the patient's illness, the patient's other health conditions, patient's age, and whether the patient required an operating room during the stay. For hospitals, the diagnosis is the key in determining the resources required by a patient. For hospitals, diagnostic codes are the money codes. So those diagnostic codes are the money codes. The accuracy of the MSDRG, which is Medical Severity Diagnosis Related Group, that's on your exam. MS-DRG stands for Medical Severity Diagnosis Related Group. So, on your exam, I might have something else. I might have a whole nother word put in there. It is dependent on coders following the guidelines for inpatient coding very precisely. For physicians, now this is stuff that you definitely have to know in ICD-10 because it's a difference but from CPT and HCPCS. For physicians, the first listed diagnosis code indicates the reason for the encounter. For physicians, the first listed diagnosis code indicates the reason for the encounter. And the diagnostic code has a support role because CPT and HCPCS provides the money code. You see how they keep talking about that money code with CPT and HCPCS? For inpatient coding, this is where the difference comes in. For inpatient coding, the reason for the hospitalization, termed the principal diagnosis, is crucial to the MSDRG formula. The principal diagnosis is the first listed code. So for CPT, it's different than for inpatient coding. The principal diagnosis is crucial to the MSDRG formula. The principal diagnosis is the first listed code. Sequencing of diagnostic codes is more crucial to reimbursement for hospitals. So in a CPT, that's not the most important part. In the hospitals, sequencing of diagnostic codes is more crucial to reimbursement for hospitals, and the rules for diagnostic coding also differ. So that's the difference between, it's showing you inpatient and outpatient. Their rules are different on how they're paid and what's most important. For example, a patient is admitted to the hospital experiencing severe chest pain and sweating. To rule out myocardial infarction, the patient requires 36 hours in the hospital to undergo intense diagnostics to determine the cause of the chest pain. Ultimately, the patient is diagnosed with anxiety and therefore, anxiety and heartburn. During the hospitalization, resources expended on this patient are identical to resources for a patient with a myocardial infarction. Therefore, the hospital would report the rule out diagnosis, MI, as the principal diagnosis. In an inpatient setting, you must be familiar with the inpatient guidelines so that the coding leads to the correct MSDRG. Coders do not need to know the formula for MSDRG. A computer program, a grouper assigns the MSDRG based on the ICD-10 codes. This is going to be in that computer-based system in whatever specialty or whatever area you're in. Many hospitalizations are medical in nature, uncontrolled diabetes, pneumonia, while others are surgical in nature, mastectomy, total hip replacement. Procedure codes are used to report operating room utilization. Procedure codes contribute to the MSDRG formula. ICD-10 PCS is the inpatient procedural coding system. PCS stands for what? Procedural coding system. In the inpatient setting, ICD-10 PCS are assigned instead of CPT or HCPCS code. So remember that in the inpatient setting, so in a hospital setting, ICD PCS are assigned instead of CPT or HCPCS codes. Procedure codes need to be sequenced properly, with the principal procedures as the first listed procedure. The principal procedure is one that is performed for definitive treatment rather than for diagnostic or exploratory purposes, or one necessary for a complication. If two procedures appear, and this is some of your questions in your daily assignments, and all of this is in this first setting, this first reading. If two procedures appear to meet this definition, then the one most closely related to the principal diagnosis should be assigned as the principal procedure. A procedure is considered to be significant if it is surgical in nature, carries a procedural risk, carries an aesthetic risk, requires specialized training to perform. So this is how a procedure is considered to be significant. Next, it states, for a procedure to be significant, it does not have to be performed in the operating room. Many procedures are performed in the emergency department, at a patient's bedside, treatment room, or in an interventional radiology department. Any procedure that affects reimbursement should be coded and reported. Most facilities will have a policy regarding what procedures should be coded. So it goes back to say, when you're in that specialty clinic, in their database, you're going to have information that's going to be telling you for that specialty what needs to be coded. So I don't want anyone to be scared. Like I said, you're thinking it's so hard. It's really not when you get in that facility, because wherever you are, it's going to be specific to what you are doing. And it's going to be in that database. Like in the hospital setting, it's a little different, because whatever department you're working in, when you're getting those claims in, then it determines on what you're going to be coding. So if you have your ICD-10 manuals, let's get those.
I grabbed the wrong book.
You have yours, Jared?
Yes, ma'am, I do.
Ebony, do you have your book?
Yes, it's big.
That's probably the biggest
That
one out
part,
of all
right,
three
Ebony?
of them is the ICD-10.
So in your, Misty loves the ICD-10 better than the CPT. Look at
I really do.
uh-huh. Look, Jared
Not me.
shaking his head. So
Jared's like, nope, not
Yes.
I.
if you look in Appendix I, I'm gonna let you all find Appendix I, and it tells you paragraphs 2. First thing, you know what we're gonna do before we do that? First, let's go, and I also have this in the video. Let's rewind. The gray section in the front, that is your index in your ICD-10 manual. That is your index. You are to always reference your index first. And then you're going to go to your tabular to verify. Because just because it's in the index, and then you might think you code from there, you are probably going to be coding wrong. Sometimes it's there, it's correct, but you always need to verify in your tabular, because when you go to that tabular, it might say see also with. So always make sure you look in your index, which is in alphabetical order. You always look in your index first, and then you verify, making sure it's correct, by going to your tabular. Your index are the gray sections in the book, and it is alphabetized. So always check your index first, and then to verify a code, you're going to go to the tabular, which is behind all of those gray sections. So if you go to Appendix I, paragraphs 2 through 4. Have you all found it? And if you don't have it right now in your book, you can look here on here. It's just going to tell you what it says. It's going to say the same thing here.
Where? Oh, okay.
Cam.
Present on admission reporting guidelines. So this is the definition on what it means, present on admission reporting guidelines. These guidelines are not intended to replace any guidelines in the main body of the ICD-10 CM, but it tells you here, the POA. So what does POA stand for?
Present on admission.
Correct. You have to know that they're not going to have, I keep saying they're not going to have present on admission. They're going to have POA. The POA guidelines are not intended to provide guidance on when a condition should be coded, but rather how to apply the present on admission indicator to the final set of diagnosis codes that have been assigned in accordance with sections 1, 2, and 3 of the official coding guidelines. Subsequent to the assignment of the ICD-10 codes, the POA, present on admission indicator, should then be assigned to those conditions that have been coded. As stated in the introduction, a joint effort between the healthcare provider and the coder is essential to achieve complete and accurate documentation, code assignment, and reporting of diagnosis and procedures. So it just tells you about those guidelines when you use present on admission. Next, we have selection of principal diagnosis. These are the official guidelines. It's going to be in section 2. In your ICD manual, section 2, selection of principal diagnosis. The circumstances of inpatient admissions always govern the selection of principal diagnosis. You have to know that, very important. The circumstances of inpatient admission always govern the selection of principal diagnosis. The principal diagnosis is defined in the Uniform Hospital Discharge Data Set, UHDDS. Uniform Hospital Discharge Data Set, as that condition established after study to be chiefly responsible for occasioning the admissions of the patient to the hospitals for care. Next, the principal diagnosis is sequenced first. So remember that principal diagnosis is sequenced first in inpatient coding. So here is where you're going to see the difference. In an outpatient setting, the term first listed condition is used in lieu of the term principal diagnosis. So see, that's where you get confused. That's the difference. Inpatient coding, the principal diagnosis is sequenced first. In outpatient setting, the term first listed condition is used in lieu of the term principal diagnosis and is used to indicate the main reason for the visit. Additional diagnosis may be necessary in order to substantiate adjunct services such as laboratory and radiology. The terminology principal diagnosis refers only to an acute care setting and is used in conjunction with the MSDRG payment scheme. First listed diagnosis refers only to outpatient settings. There are specific guidelines that assist with the selection of the principal diagnosis. Next, you have the code, symptoms, signs, and ill-defined conditions. Codes for symptoms, signs, and ill-defined conditions from Chapter 18 are not to be used as a principal diagnosis when a related definitive diagnosis has been established. So we're going to do exercise 27-1. A 63-year-old male, this is an example so that you can understand how we get into these answers. A 60-year-old male is admitted with chest pain. Cardiac enzyme levels are elevated, and the ECG, what is ECG? Does anyone know what ECG stands for?
Electrocardiogram.
Correct. Electrocardiogram indicates an acute myocardial infarction. The principal diagnosis is acute myocardial infarction. Chest pain is not coded because it is a symptom of the definitive diagnosis of acute myocardial infarction. So I want you to understand where it says symptoms, signs, and ill-defined conditions. That's not the main term. That is a symptom of the myocardial infarction, chest pain. So chest pain is not coded. So they have it here. Let's code this together. And keep going back to this example because it's a great example. For an acute myocardial infarction, infarction is the manifestation. Acute indicates the episode of care, and myocardial indicates the general site of the infarction. So locate the term infarction in the index. I want y'all to go to I in your ICD-10 manual. And it's alphabetized. So go to I, locate the term infarct. It's going to infarction in the index. Let me know when you all find it.
Okay. Okay.
You found it? What about you, Jared and Ebony?
Ma'am, I've got it.
I got it.
Ebony?
I'm still looking.
Okay, look under I and then go all the way down to infarction. You in 2023, huh, Jared?
Yeah.
You know, Miss Berry, mine's 22.
Yeah, that's fine. The same thing. Just tell us
Okay.
different page numbers.
Okay.
Jared, Ebony, what book do you have?
I'm 2023.
Okay,
It's
have
on
you found it
303.
yet?
I found it.
Okay. Alice, we're looking in the ICD-10 manual in the gray section. We're in. You have your
I'm
book?
sorry, I can't get to my book because I'm at work.
Oh, okay, that's fine.
Yes, ma'am.
Okay, so it says locate the term. You all have located the term. It says under the term infarction, locate the subterm myocardium. So do you all see that?
Yes, ma'am.
Yeah.
Have you located it, Jared, Ebony? I just want to make sure so you all know how to get it.
I got it.
Yeah, we got it.
Okay, note after myocardial, you find acute. Do you all see right after that you see acute?
Yeah.
And then it tells you and are directed to code 121.9.
Mhm.
And in here it says you can never stop at the index. So see, you can't just stop there. You must always refer to the tabular. Otherwise, you will miss important notes such as additional characters required. Now turn to 121 or I-21.9 in your tabular. I-21.9 in the tabular. So that's behind the great sections in your ICD-10 manual.
So what are we, wait.
You're looking for code I-21.9 in the tabular.
You say in tabular, now I just got this book, so we're in the blue section, the
Okay,
table
it's behind the gray section. So once you go all the way and pass up the gray sections in the index, all of your gray is the index.
Yes, ma'am.
After the index starts the tabular.
Okay, and we're going to I.
21.9.
Now, how do I 21.
So you're gonna go to the alphabet.
Uh-huh.
I-21.9. Did you find it yet, Jared?
Yeah.
Ebony?
1.9.
I'm lost.
I didn't hear you, Ebony.
I said I'm lost.
Okay,
Okay, I got it. 21.9.
okay, so
Ebony,
once you go ahead, Jared, you can explain it to her.
it's you're gonna go through the chapters. The book, there's different colors. The color you're gonna go to is green because that's chapter 9.
Okay, now I see it. I see the green.
Yeah. So it says subsequent ST elevation, a stemming.
Okay, so Ebony, 1 minute, you're on, so you found I-21.9?
Well, I'm in the green looking for it.
Okay, let me know when you have it. So, and then when you start the tabular, it'll say it, because anything, once you pass the index, which is all of the gray section, the colored pages start your tabular.
Okay, I see it now.
Okay, so it says, now you have that, now turn I-21.9 to the tab. It says under I-21.9, it will state unspecified site. There are no additional notations required. The complete correct code is I-29.9. So see, it tells you there, unspecified site.
Repeat that, Miss Berry. The complete code is I-22.9 or I-21.9.
I-21. Yes,
Okay.
yes, I-20. So now it says,
So if it said nothing else after
because
it,
it says unspecified site, there are no
Okay.
additional notations required.
okay.
So does everybody understand that?
Yes, ma'am.
Yeah.
So now, guess what? You all are going to try one, and you're going to tell me what page and where you are and where you're getting it from. First thing, it says, a patient is admitted to the hospital with severe flank pain and hematuria. A urinalysis is done, and it is positive for Escherichia, which is E. coli. The discharge summary states acute pyelonephritis due to E. coli. What is the principal diagnosis?
Is it blood in the
E.
urine?
coli. It's E. coli.
Which one we're on? I'm trying to go. What is the principal?
E. coli.
Not E. coli. See what it says?
I said it was blood in the urine.
Where are you getting blood from?
Severe flank pain.
No, it's,
Okay.
let me read it. A patient is admitted to the hospital with severe flank pain and hematuria.
So that's
A
two symptoms. That's blood in the urine and flank pain. So
Okay,
that's a symptom.
Listen, a urinalysis is done, and it is positive for Escherichia coli, which is E. coli. The discharge summary states acute pyelonephritis due to E. coli.
Is it
Is
the
that
people?
your
Yes,
Is
Ebony said
that a kidney stone?
no. Ebony said it right. It's pyelonephritis.
Because that's what they found
Yes.
after they. Okay.
Okay.
Correct.
So we're gonna look
So
up.
the principal diagnosis is pyelonephritis. So next it says, locate the principal diagnosis in the index. What code does the index direct you to locate? So what is the ICD-10 code? Where does it take you? If you look up that, what is the code it's telling you?
So we're looking at
Pyelonephritis, yes.
Okay.
So you're gonna go in the index, and where are you gonna start? What letter are you gonna look up?
P.
Yes.
What is it? P-Y.
Pyelonephritis. And what does itis mean? What is itis?
Condition, like it's
No, itis is inflammation of. When it says itis,
inflammation of.
inflammation of.
So what are we looking up? Okay. hang on.
Pyelonephritis.
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 I ain't found it yet. P-Y.
Pyelonephritis.
It's on page 409.
Oh, that's way off.
I got
So
it.
you have to be in the index. No, you remember she's in 2023. You're in
Yeah,
2022.
So,
Our page is gonna be different.
Your page is going to be different, Julie.
okay, so I'm in the P's, or I thought I was. No, I'm not. I'm not. Hang on, y'all. I'm getting LMNOP.
So, okay, I want to know if she has, I want to know if Ebony and Jared has the right code yet. So what is the code that you have?
Wait a minute. Hang on. Give me a
Okay.
hang on. Just give me a chance. PYELO.
Yes,
PYLONEPHRITS.
Hold up with the code, you all.
They're putting the other cards on the elevator.
PYELON.
You got 4 on there now, but he got the other 2 on there, so you got to send the 4 down.
PHRITIS.
Okay. So it's inflammation. So, oh my gosh, they've got
Okay,
all
so
these.
you're looking for the word though. You're
So,
looking for pyelonephritis.
Okay. With is okay.
So you found that word?
Yes, ma'am. It
Okay, so
also
now,
says
what is the code you all
nephritis.
have?
It's gonna be
N10.
In
Yes,
what?
N10.
N10 is correct.
Okay, so mine says C polio.
Right, so but the code first, what is the code you have first next to it? Isn't it N10?
It says N20, or that's with.
You're not in the
You gotta
right
look for
place.
acute.
I don't see N10.
You gotta look for acute.
Okay, wait a minute. No, that's not the same. Oh, I got you. There it is. N10.
You have
Okay.
it?
Yes, ma'am. I got it.
Okay, so next it says, was there a mention of a lesion in the case above?
No.
I don't
Great.
know. I don't remember no lesion.
You're looking at it now, right, Julie? In your book, in your ICD-10.
What are you asking me?
It says,
It
the
says
question says,
N10.
was there a mention of a lesion in the case above? So did I mention anything about a lesion?
No.
No.
Okay, right. So that answer is no. It says, what is the correct principal code for this case?
N10.
Correct. Why do you think severe plank pain and hematuria are noted on this patient's case?
Because it's a symptom of that.
Exactly.
Because that was one of the symptoms. That's why he went to the hospital.
Right. So you see how you have to differentiate between to get that what it actually is, what that diagnosis was. So all of that other stuff were symptoms.
Right.
Yeah.
So that's how you do and you get to those symptoms. And you know, so you're not looking for that. You're looking for what the actual reason was, what actually happened. So you all did very good. So did that clear up a little bit?
Yes, ma'am.
Up a little bit for you? So when you look at, that's why they break it down in each section. So this was symptoms, signs, and ill-defined conditions. And it lets you know. So always go back to read what it is. So you're not going to be coding the symptoms.
Right.
You want the actual, what are they really there for?
What brought you there? Okay.
Yes. Next it says 2 or more interrelated conditions. 2 or more interrelated conditions, each potentially meeting the definition for principal diagnosis. So this is a little much more tougher here. When there are 2 or more interrelated conditions, such as diseases in the same ICD-10 chapter or manifestations, characteristically associated with a certain disease, potentially meeting the definition of principal diagnosis, either condition may be sequenced first, unless the circumstances of the admission the therapy provided, the tabular list, or the alphabetic index indicates otherwise. So this is a little doozy here.
Yeah, explain that.
We're about to go through it, and we're about to go through it.
Okay.
Yes.
All right.
So always remember to read the guidelines. And so it's telling you in section 2 in your ICD-10 manual, in section 2B in your manual, in that coding manual, it tells you the definition about 2 or more interrelated conditions, each potentially meeting the definition for principal diagnosis.
Zay,
Go.
hey, close my door. I'm sorry.
That's okay. A patient is admitted with chest pain, shortness of breath, and a heart murmur. The patient undergoes a diagnostic cardiac catheterization, which shows 2-vessel coronary artery disease, native coronary arteries, and severe mitral valve stenosis. It is recommended that bypass surgery with mitral valve replacement be performed as soon as possible. That was a lot going on, huh?
Yeah.
Next, excuse me, the patient has 2 conditions, each of which has the potential to be the principal diagnosis: mitral valve stenosis and coronary artery disease. A, locate stenosis in the index.
Stenosis.
So where are you going to look first?
The
In your
index
index.
under stenosis.
Right, what letter? You're going to be looking in the S's.
S-T-E-N.
Yes. S-T-E-N-O-S-I-S.
Okay. So I got stenosis.
Okay, locate stenosis in the index. Both mitral and valves indicate the site of the stenosis the patient has. So the condition is stenosis. Under the main term stenosis, locate the subterm mitral.
Okay. Hang on. Stenosis. I'm still looking for. Okay, hold on. And what was it? Mitral?
Mitral, yes. So in the gray section of index, you know it's alphabetized. You're under the
Yes,
S.
ma'am. I got stenosis.
Now for that subterm, you're looking for mitral. M-I-T-R-A-L.
I got myocardial. Okay, here it is. Mitral.
Okay.
We got chronic inactive valve.
Okay, the words in parentheses indicate the kinds of mitral stenosis, such as, like you said, Miss Julie, chronic, valve, or inactive. You are looking for valve.
Okay, valve.
So the correct 4-character subcategory code for the mitral valve stenosis is likely to be, what is it they have on there?
I-05.
Yes.
.0.
Right, IO 5.0. So it says, next now, locate coronary artery disease by locating the main term, disease. So you're going to go
coronary artery disease. Coronary artery.
The main term, disease.
It's coronary.
No, the main term is disease.
Oh, a disease. I'm sorry.
Yes. So
and then we're going to look up.
Stop at that part first. First, look up disease. In the gray section, the index, under the letter D, find disease.
Disease, diabetes. Goodness, no wonder this book is so big. Disease.
Yes.
Okay, disease. Okay.
You all have it, Ebony and Jared?
And we're looking up coronary.
I'm still looking.
You still looking for disease?
Yeah.
Okay, let me know when you have it.
It's coronary. Coronary artery disease. It says,
But wait, Miss Julie,
Wait.
we still have some looking for disease.
oh, sorry, I'm so sorry.
That's okay.
So I got disease.
Okay, I got disease.
Okay, waiting on Ebony.
Yeah, I'm still lost.
Yeah, you're in the D, look up disease. You're going in the D's, go all the way down. What page are you on, Ebony?
$437. Well, not
You
437.
too,
436.
you're too far. In the index, it's
206 and
it's
22.
on. Yeah, it's 206 and a 23 also.
Oh, I was still under the S word.
No,
I
We
thought
got
it was
disease.
under that word.
Yeah, we're looking up disease. So I know you said it was on 206 in both books, right?
Yeah.
So page 206, disease. And the subterms, artery and coronary. Find that. The subterms are artery and coronary.
Okay.
So then it says the entry directs you to see arteriosclerosis coronary.
Okay, you lost me there. I got coronary artery. It says disease, heart, ischemic. What did
So
you say?
it says the entry, when you go, it says when you get to disease and you go down to the subterms artery and coronary,
Yeah.
Yes,
it says
ma'am.
the entry directs you to see, and it says to see arteriosclerosis coronary. Do you all see that?
Yeah.
It says under the main term arteriosclerosis and the subterm coronary artery, you will be directed to code. What does
Okay,
it say?
It says disease.
You lost me at that point. I've got coronary artery in parentheses. It says C, disease, heart, ischemic. And then, so where am I getting lost at?
Okay, so under the main term, arteriosclerosis, do you see that?
Arterial.
It says the entry directs you to see arteriosclerosis. So that means,
Arterial. So wait a minute, I gotta go back over to the A's.
yes,
No.
that's where it should be, right under there, the subterm.
I've got coronary artery in parentheses, and it says C, disease, and heart.
Uh-huh.
Ischemic, and can't say that last word.
So, okay, it says the entry directs you to see arteriosclerosis coronary. Do you all see that part?
Yeah.
Under the main term, so under arteriosclerosis and
Am I the wrong one? I'm under coronary.
you're okay. You should be under, you don't see arteriosclerosis?
No, ma'am. Should I go back to the A's, arterial?
Okay, say right where you saw disease and you said, and the subterm was artery.
The subterm was coronary and artery in parentheses. Am I in the right spot?
Right. And so it
Okay.
says the entry directs you to see arteriosclerosis coronary.
I mean, I don't know.
So go down under where you are. Do you see arteriosclerosis coronary?
I got arteria, so I got
Sclerosis.
no, it's ATHEROSCLE something
Yeah, that's the word. That's it.
chlorotic or
Coronary.
congenital. Asterog.
So you're there.
Okay.
And then the subterm you had was coronary. It says you will be directed to code. What code do you see there?
Q245.
No, it says you will be directed to code I-25.10.
See, I think I'm in the wrong. I don't know if I'm in the right spot. I'm under disease.
Uh-huh. And then
I'm
under that subterm, you see artery and coronary.
I see artery, coronary, and artery is in parentheses.
Right. And then
And
it
then
says
disease heart.
Then it says the entry directs you to see arteriosclerosis coronary.
I got
They have
arterial.
the coronary word by itself. That's the code. She looking
Okay,
at have coronary artery,
Yeah.
but it have one by itself, coronary, and it's I-25.10.
see, I don't
that's
see
the correct.
I-25 anything.
You gotta go a little bit more down.
Okay, honey. Thank you. Let's see. Congenital pulmonary aortic mitral.
No, we didn't say anything about congenital, Miss Julie. Keep going down and you're gonna until you see I-25.10.
I-25.
Mm-hmm.
Oh gosh, I don't see that at all. And we are on page 206.
Yes, the last column, almost at the bottom.
It's what, baby?
The last column, almost to the bottom.
The last column?
Yes, on 206. It's okay, baby.
I don't know, y'all. Anyway, I don't know.
So you don't see it, Miss Julie, at the bottom of the page, I-25.10?
No, like honestly, I don't.
Okay, well, let me move on right quick with this one, then we're gonna come
Okay.
back.
Yeah,
It
that's
says,
fine.
if the tabular validates codes I-05, I-05.0, it says mitral valve stenosis, and 125.10, coronary artery disease, native artery, either code could be sequenced first because none of the information indicates one condition warranted more than the other. So when it's two or more interrelated, if it doesn't say anything different, then you would code both. Because one didn't,
Okay,
it doesn't matter
would
if it had
put
to
both.
be sequenced more over the other one.
Okay, but you would have to put both. Okay.
Yes, that's why it says on here, two or more interrelated conditions.
Yes,
So you
ma'am.
would put
Okay.
both codes.
Okay.
So with that, Miss Julie, I want you to go back in that index when you get time and look for that I-25.10. It's on that same page. Didn't you all find it on 206?
So I looked at disease and
Yes.
I looked at the coronary. Okay, so mine says coronary, and then in parentheses it says artery.
I can't hear you, Miss Julie.
It says, so you go to coronary, and in parentheses it says artery.
They have another one down, farther down.
Okay, hang on. Is it coronary?
Yes. I-25.10.
Well, mine are going into the Z. Okay, so maybe
I-25.10, Miss Julie, is what you need to be looking for. Look for I-25.10.
I-25.10.
Recording in progress.
It's gonna say heart, artery, and then cannulary again. How you
Yeah,
say that word?
carotid. Mm-hmm.
I mean, I'm sure it says it. I'm just not seeing it. Carotid. I don't know, y'all. I'll have to look when I don't know.
Okay, so we're gonna go on to the next one, Miss Julie.
Yes, ma'am.
And
Go
then I
ahead.
just want you to go back and check that I-25.10 when we get off, okay?
Okay.
So the next one, a patient is involved in a car accident and is admitted with an open fracture of the right humerus and an open fracture of the right distal femur. Both fractures require open reduction, which means that the fracture will be repaired using an open incision into the fracture site. What are the two diagnoses?
Oh, yeah. An open fracture to the right humerus and an open.
This is a tricky one.
So it's a it's motor vehicle crash.
What are the two diagnoses?
The two
Open
broken,
yeah, two broken.
the open fracture on the right humerus and the open fracture on the right distal femur.
And the right distal femur, yes. Either of these diagnoses may be principal because both are addressed and plans are made to treat both surgically. They were equally the reason for admission to the hospital. It says, under what main term in the index would you locate both diagnoses?
Well, is the main one motor vehicle crash? And you're going from, no?
You said a crash where you lost me, Miss Julie.
Oh, I thought it said well, I'm calling it a motor vehicle crash. It's a car accident. It's either an MV. I'm trying to go off on something else.
Okay.
A motor vehicle crash is how it's coded, like in the ER, but it just says car accident.
Yes. So it says next, it says under what main term in the index would you locate both diagnoses?
Under bone? Under bone?
I'm a guess fracture.
Yes, it says, yeah, under, so fracture and what else?
I wonder what that one is.
So when you go under fracture, look under fracture in the index.
Uh-huh.
And under fracture, what is something else that they're saying about it?
Hold on 1 second. Let me get the fracture. Traumatic.
Correct.
What?
Traumatic. If you go under fracture, which is in the alphabetic index, under F, you will go down to fracture.
Traumatic.
You see it?
Yes, ma'am.
You
Traumatic.
see it?
So it was the right
So that's
humerus.
B. It was under what main term in the index would you locate both diagnoses? So both diagnoses would be fracture and traumatic. It says, and then look, it says, after the main term fracture, what would be the first applicable subterm for the fracture of the right humerus?
The humerus.
Right. Humerus. Then D says, in the tabular under S42, so look in the tabular under S42.
S for what? S
For the number 4, the number 2. In the tabular under S42, what 7th character would you report for an initial open fracture?
Oh, Lord, you lost me.
Okay, so you have to look under S42.
So, are you saying S42?
S as in Sam.
So we're under the S's now.
In the tabular, which is after the gray section of your index.
Okay, so in the S's.
Yes, S as in Sam. And you're going to go to S42.
S42.
Yes, like 42.
S42.
Other shoulder, upper arm.
So what? Let me see.
The appropriate 7 characteristics to be added. Initial encounter for an open fracture.
So what 7th character?
S42.
So what is it? What 7th character would be added?
Yeah, it's all four from the S42. They got A, B, D, G, K, P, and S. That's the different characters that they have.
I know. So what letter you gonna use?
Okay, so there would be the initial encounter for it's an open fracture, so it'll be a B.
Correct, Jared. That was great, Jared.
Wait a minute, what was it? B?
Yes.
Yeah,
What page are you on?
Me? It's
Yes.
It's
1303.
My
twen-
my page in the 23 is 1320.
Okay.
Oh.
Ebony, did you find it?
I'm still looking for it.
Okay,
It's
so
on page 20.
you went out, Jared. You blanked out.
Oh, 1320.
Okay.
Okay, so a fracture. The appropriate 7th character is to be added to all codes from category S42. So initial encounter for open fracture. Were they both open fractures, I guess? Oh, Lord. My head
Right,
hurts.
both of them were open fractures.
Okay.
So initial for open fracture, so it'll be B.
Yes.
Okay, I see it.
What was the code? Like, let me write this out. Like, what did it look like?
It's
So
it's a S42.
it's just S42
301B.
301B.
Uh-huh. Because B was initial encounter. And they both were open fractures.
Where did we get 301B? Oh, Lord.
When you started out, when you looked in the index, and when I told you in the tabular under S42.
Oh, okay, I gotcha.
They
Oh,
all the way. It's an unspecified fracture of the shaft or the humerus right on. So that's the 301. And then you got to put the B
For the open fracture.
for the open fracture. Okay.
Okay, E. Because the patient case states open, you know that S42.301A is not the correct code because S42.301A specifies closed. Applying the correct 7 character for initial open fracture. What is the correct code?
So it'll be the S42301B.
Correct.
Wait, I'm not seeing where we get 301 from.
That's where I was lost at.
So when you go back under, I'm trying to go back under here.
To the index?
So in the tabular under S42.
Mm-hmm.
Wait a minute. S42.
And as you go down.
S42. Okay.
And you're reading. And you're going to be looking at the open fracture for 2. The open fracture of the right humerus and the open fracture of the right distal femur.
Mine goes from 1 to, I don't know. What was it? 301.
Yes, S42301B.
And that's for the
Okay,
arm.
I see it.
Hey,
You see it,
Okay.
Ebony?
Uh-huh.
Yeah.
Okay.
Okay.
So then it says in the tabular, so it says, because the patient case states open, you know that, the A was incorrect and we found that it was B. So it says in the tabular, does the code you chose in the index match the description? And if it does, why?
yeah, it matches it because it has everything. It's a unspecified fracture.
Open.
And then you have the open, which is the the open part of it is the B.
Right. Correct. Very good. So F states, you still have to locate the code for the open fracture of the distal femur. After looking in the index, using the main term fracture, what is the subterm you would locate?
Oh,
The femur?
Distal
Correct.
The
Femur.
femur.
to be femur.
Correct.
Let's go back to fracture.
And then what is the next subterm?
Femur.
The distal.
Yes,
Distal femur.
distal or distal end. What does this subterm direct you to do?
Wait a minute. So we got to go back to fracture.
Mhm. So when you go back to fracture, what does this subterm direct you to do?
Hang on. EF.
So go back to fracture. The subterm is femur. What does it direct you to do?
Fracture.
Hold
Okay.
on.
What are we looking for? Femur. Femur. Femoral. S72.9.
Ooh, you were close. You were close.
Wait a minute. Okay. Wait a minute. What does it say? Hang on. Don't tell me. It was distal femur, wasn't it?
Uh-huh.
Okay, so for that distal femur, the lower end, see fracture femur lower end.
Mm-hmm.
The lower end is S7240.
All right, Julie.
God was with me on that one.
Look at that, Julie. You got that one on point.
I tried.
But guess what? You're not done. So it says,
Oh Lord, how many? Look, let's just say Joe broke his arm and be done with it.
so it
Well, that's
says, no. If open or closed fracture is not stated, assume it is a closed fracture. So it says, after checking the tabular, what is the correct code for the initial fracture of the lower end of the right femur?
Okay, wait a minute.
You just said it.
Uh-huh.
Oh,
But you got to add something else.
the S72. Oh, where was I? Lower end. Oh, where was I?
41B.
All right, Ebony. All right.
There you go.
And the reason why you put the B because it's a open fraction.
Exactly.
Oh, Lord.
Exactly. This was a great class. I mean, see why we have to do the hands-on and you have to do
Yeah.
it.
Yes,
I'm more
ma'am.
hands-on too. I learned more hands-on.
Yes.
I do too. Yes. Thank you, Miss Berry. I enjoyed that.
So then also with the videos that I post, make sure that you go through them with Contempo, like when she's doing it and showing you, have your book out and looking at that and doing it with her. That's the only way you're going to actually know how to do it. And like I state, don't just copy the answers out the back of the book, because when we do our classes for the new ones, I mean, Jared knows, and like Misty knows, like, I want you to tell me the page number. You know, I'm not just letting you get it out the back of the book, because anybody can do that. But when it comes to that certification exam, you have to know how to find the codes. So get it out the back of the book, use that as a reference to, you know, just to make sure that, okay, if you see it in the back of the book, then go find that in your manual.
Y'all keep talking about the back of the book. Where's the back of the book? What are y'all talking about?
In the back of your ebook, they have the answers.
The odd number answers.
No, the
So,
even.
yeah,
But your workbook is the odd. Your even is your tabular. I mean, your book is the even. Everything. But I'm saying, use that as a guide. Like, you can look in the back and see what they have and then go find it. And so then you're going to know how to look up that main term. Okay, well, look at this. This is what I need to look up. It's trial and error. You're not going to get it the first time. That's why I like to do hands-on and make you work for it.
Yeah.
You know? Make you work for it so you understand what you're doing. And it's going to take time. I mean, look, it's 5:21. We done been on here an hour and 21 minutes. Struggling. Look.
Struggling.
But you got it. You know?
Yeah, we did.
Practice makes perfect. And that's why kids said I put videos in today's assignment, the lab, also in your Zoom class. This will be put in Zoom class for you to go back and reference, to review and look at. Also remember that your chapter 26 exam is due on Sunday. That is due on Sunday, but remember, chapter 27 started today, which is chapter 27, inpatient coding. That started today. So just make sure that you're reading your PowerPoint slides, you're reading your emails in its entirety, you're going over, if you have questions, ask. And again, use the answers in the back as a reference. Look at those videos from YouTube, Contempo. Work with her, look at it, get your book out when she's giving you information to be able to look through it and go through it. I put in 2 different videos in your Zoom class. So make sure that you all are getting information. I mean, Ebony, did you say this was a better help? You understood more now?
Yeah.
Yes.
You know, and continue, like I said, to look at those videos. And when we have class, that's why it's important to, you know, attend Zoom class. I know everybody have different schedules, but go back and watch the videos. Get your book when you're looking at the Zoom classes and go and work through it with, you know, with the video. And just, you know, review, practice, make perfect. Like I say on your exams, if you 1 or 2 numbers off, I'm not marking it wrong, because you're learning. This is a class, you're learning. So I might not give you all of the points, especially for my new ones. You're still going to get it if you're 3 or 4 points off, because you are learning. You're a student. Practice makes perfect. So again, you all have a great Thursday. Remember, next Thursday and Friday, we do not have class, you know, in observance of Thanksgiving. I will see you all, and I'm on vacation next week. So we will not have class on Tuesday. And we're closed Thursday and Friday, so that's nothing to worry about. But I will have assignments posted this week for you all to review. But we will not have Zoom class. And I'll send a reminder on Friday letting you know we will not have Zoom class next week, but your assignments will be open. I will still be checking attendance. That's it, but we will not have classes. So if you see you don't have anything checked on your assignments, that's because I'm on vacation. but I
Okay.
will be checking them when I get back. So I don't want to get all those emails. I got a 0. I got a 0.
Well, y'all have a happy Thanksgiving.
Yes. Y'all have a happy Thanksgiving. You all be safe.
Happy Thanksgiving.
Enjoy.
Happy
And
Thanksgiving.
happy Thanksgiving. And I will see you all after the break. Remember, come back on Monday. Don't take it too hard. And don't come back. See y'all on the next Monday.
Okay. All right. Take
Enjoy.
care.
Bye-bye.
Bye-bye.
Bye.